Hello and welcome to today's webinar, Unlocking the Potential of STI Testing in Urgent Care, Business, Population Health, and Clinical Perspectives. My name is Samantha Burke. I am NARUCA's Administrative Director. Now, for those of you who don't know, NARUCA is in its 12th year of existence, and today, NARUCA provides grassroots local representation in partnership with UCA's National Strength. We integrate urgent care medicine into broader public health initiatives, and we provide education and advocacy for urgent care medicine in the Northeast region. Now, lastly, I would like to thank our platinum sponsors for their continuing support, HealthTrack RX. And with that, it is my distinct pleasure to introduce you to Ben Fabre.
Thank you, Samantha. No matter your role in urgent care, today's webinar has something for you. Here's why. Today, we're going to discuss the clinical, operational, and financial challenges and opportunities regarding treatment, a special patient type, patients with sexually transmitted infections, unlocking the potential for STI testing in urgent care. My name is Ben Fabre. I'll be your host for today's session. Now let me introduce our experts. We begin with Alan Ayers. Alan's the president of Urgent Care Consultants. Alan, you've published extensively on improving urgent care operations and efficiency. Thank you for joining us today. Next, we have Dr. Stephen Goldberg. Dr. Goldberg is the Chief Medical Officer of HealthTrack RX, and more importantly, is an emergency room physician and an urgent care physician with the University of Louisville Health, and really understands what it's like at the front lines treating these patients. Ali Prigo is the Medical Science Liaison for HealthTrack RX. She's also a physician assistant with Modern Pediatrics. Dr. G, I want to turn it over to you. Let's talk about STI testing from a population health perspective. What have we learned and what should we be expecting in the future?
Well, thanks, Ben. What we've learned is there is a huge burden of sexually transmitted disease. What we see for the opportunity is to get people engaged and treated and stop the long-term sequela of untreated sexually transmitted disease. I'll talk about 5 key, if you will, population health topics. What's the burden in the US of STD? How do we think about segmenting populations who might have STDs and particular needs? Third, we'll talk about women in particular. Because of their anatomy, they're at risk for particular long-term sequela that's very concerning. Fourth, we'll talk about barriers to care. And it's because of those barriers to care that urgent care can be a great solution to help address this problem. And finally, we'll show at a population level, if you engage STDs, you reduce that long-term sequela. So it's a win-win-win. So first, the burden of sexually transmitted disease. We wanted to present CDC data, and this shows, based on reportable information, that we're having over 2 million reported infections per year, with chlamydia and gonorrhea, 2 of the most common reported infections. Now, there are multiple different infection types not represented here. There are others that require reporting, not represented here, but chlamydia and gonorrhea are most dominant. That said, the CDC overall estimates that about 1 in 5 in the United States could have a sexually transmitted disease at any time. So these numbers, frankly, are likely underreported. Some of that might be reporting barriers, some of it might be legacy from the pandemic, but the overall point is sexually transmitted disease infection is really quite broad. And what we mean certainly about a sexually transmitted disease infection is that it's a pathogen. It's a bacteria, it's a virus, it's a parasite spread between 2 people through sexual contact. When we think about the burden of sexually transmitted disease, like other issues, we want to think about particular segments of the population and what particular sexually transmitted disease issues are they dealing with, and that will help us target our service strategy. So frankly, as we look across these 5 images, we have a common group, which is adolescents, and they can represent, frankly, almost 40% of cases of sexually transmitted disease occurs in those between ages of 15 and 24. A huge burden. In men who have male partners, they have a particular profile of challenges, which is a co-infection with, for example, HIV and syphilis. So we want to think about that issue. For Hispanic, Black, or African American individuals, They represent almost 32% of infection events, but only 12% of the population. So they're disproportionately underserved, disproportionately undertreated. Individuals who are Native Americans also have burdens of high risk of untreated syphilis, both primary and secondary. And as mentioned earlier, the left profile is the silver tsunami. About 11,000 people per day in the United States are becoming 65, many in second relationships. And so sexually transmitted disease is a more prominent consideration in that population. Particular concern about women and women who have sexual transmitted disease because what it can do to their anatomy. First of all, a big factor is that chlamydia infection, Neisseria gonorrhea infection, which are prominent reportable sexually transmitted disease, are often asymptomatic in people. And as a consequence of that, people can have the infection and inflammation going on without being aware of that. Very concerning. In terms of a population, sexually active women, 15 to 24, account for almost half of all new infections. And the untreated chlamydia and Neisseria gonorrhea can be devastating. It can cause chronic pelvic pain. It elevates the risk of ectopic pregnancy. There's higher risk of co-infection with HIV and also risks for infertility. We'll show later, though, that there's opportunity, that many of these conditions are treatable, curable, and when treating and curing, you stop that long-term sequela, which is very satisfying and a motivating reason for even discussing today's topic. Now, one of the reasons that we thought this conversation today would be appropriate about urgent care is the realization that all these different segments of individuals have barrier to accessing care for sexually transmitting disease. There's rising gynecologic wait times. 50% of the counties lack an OBGYN provider. There are fewer OBGYNs in training. There are barriers to primary care. And sadly, your economics can impact your access to care. So if you have Medicaid, you have longer wait times to get access to care. These are all barriers that urgent care can help relieve. Now, the good news, the motivating news for me as a clinician is that many sexually transmitted diseases are fully curable. And with curing them, you prevent that long-term sequela and the unintended consequences of untreated infections. So if you treat sexually transmitted disease, it's associated with a 30% decrease in hospitalization for PID. If you treat sexually transmitted disease, it's associated with a reduction in ectopic pregnancy. If you treat sexually transmitted disease, there's a significant reduction in pelvic inflammatory disease rate. And also that's found with treating other sexually transmitted disease, such as syphilis. So there's a good story here. What I would say is Alan talked about the opportunity for our urgent care colleagues to provide the service and the benefits economically and in terms of service by taking on these patients. I wanted to give an overview of the population health outcome. It's a huge burden, 1 in 5, lots of opportunity, able to make a difference if we get on it. And now Ali will take us into the exam room and how we actually approach these issues in the clinic.
Thank you, Dr. Goldberg. We can see the patients coming, right? I mean, and that's the real key. You need patience. And I think every population, no matter where your urgent care center is, you can see where those patients can come from. A couple closing thoughts. One is the high prevalence of STIs today and the growing demand is really, the silver tsunami is kind of one of those terms that's just stuck in my head. So I think this really kind of creates an overall impact across all demographics. It's not any one patient type. It's everybody you see walking into your clinic today has a high probability at some point needing STI testing. So you're already treating these patients. They may not just be coming to you, which I think is kind of a new way to think about it, to Alan's point. The long risk health consequences to STIs, if you're a young lady or gentleman looking to start a family, if you don't get taken care of sooner rather than later, this could be a life-altering event. And the success of treating it and getting that treatment is profound. The opportunity for urgent care, Alan, when you laid out those statistics around half the practices not doing this testing, that was shocking. And then to see that the best practices are doing it, success is simple. Find what works and consistently reproduce it. And this is something that just kind of jumps out there is that if I'm not in this business, I'm fighting with one hand behind my back. And then, Allie, I thought just a great job on the operational efficiencies, what testing to use, and then how to deal with these patients. Because really, it's about getting patients healthier faster. That's what they care about. Every clinician I know, that's what they care most about. With that, we'll conclude today's webinar. Thank everyone for participating today.